Yeah, and I think, one of the things that I think you're so great at is communicating clearly some of those concepts that can sometimes feel confusing or even emotional for clinicians, to be able to distill it down to very practical steps and what it needs to look like for them in their practice, right? It wasn't just, summarizing studies. It actually went like that, that step further around how do we consider this as part of your patient care experience. What was it like for you to facilitate the perinatal fellows? Because you were part of that process for 2 years, working with that group of fellows. And so many of them have gone off to do such incredible things themselves. And you were really part of that journey for them and helping them grow as clinicians. What did you take away from that experience, or what was that experience like for you?
So that was one of the most fun things that I've done over the last like 5 years, was sitting with that group of clinicians twice a month and really getting, I would say, into like the meat and potatoes of what we really want them to know, unlearning some things. So sometimes we learn something in school and we just keep doing it for years and years because that's what we learned and that's what we kind of gravitated to. And then breaking that down, like, why are we doing that? Is that still helpful? Is that what the evidence says? What does the evidence actually say? What are we supposed to be doing? Because, of course, we're learning more each year and there's new studies published all the time. So, being able to sit in that discomfort of like, why do I recommend that? Or why is that my go to? Or why am I running this test? Or why am I not running this test? Which that discomfort can always be hard, right? Because we're challenging what we normally do day to day. But it's also so fun because then we're able to, after that, rebuild like, what is it that is the best next thing to do? Why is it? And have those conversations with, again, different naturopathic doctors that were from Canada and the US with different perspectives. I always appreciate the different perspectives that every person brought based on where they were at in North America, or even where they were at in their clinical career, if they were new grads or if they'd been practicing for a decade, how that differed. And then the community with those people was amazing because, like we said, I'm from a small town. And that's one thing that I have really appreciated is starting to connect with other people that are doing other things like myself across Canada and the US, because it can sometimes feel like when you're in a small town, you're the only person who cares about this thing. Or you can even meet with the other NDs in the area. They had such a different focus than what I was focusing on. We didn't really relate, or we couldn't have that same back and forth conversation. So, bringing together a group of like minded individuals who all kind of had that same passion for evidence based medicine, that we're all trying to, push towards this greater goal of making all of ourselves better as clinicians. There's so many pieces to that, but the community was unlike any other.
Yeah, I love it's funny because sometimes when we're sharing that there's community baked into things that we do or things that like other programs do, I think we almost think of it as like a sidebar, right? Like, oh yeah, right, it's in a group. Like, oh yeah, right, there's dialogue. All right, like I can get my questions answered by someone who's been in practice for longer than me. And yet, like, when we've come through an experience like that, it's often the things that people care about the most, right? When you come through the experience, because when you have that kind of support, you show up differently in every hour of your work, right? Not just like, oh, I was given this piece of knowledge and now I have this piece of knowledge and now I'll use this piece of knowledge. But when you feel that level of like support and connection and community, every one of your patient interactions actually changes, or at least that's what I think. What do you think?
Yeah. And it also changes, like you said, how we show up each day. So if you know, or it makes me feel better knowing I'm not the only one, sitting on PubMed, scrolling, looking through these things, trying to like figure out what's the next best thing to do. It makes me feel like I'm with, even though I'm doing this alone in my own clinical office, it makes me feel like I'm doing it alongside these other groups of people who are also trying to do the same thing, even if we're studying something different different or we're looking up something different. It's kind of like at school when you study with your colleagues and you're all trying to work towards the same exam, right? It's a similar feeling, but then not only can we help clinicians be better, but we also are better clinicians for our patients. So the things that I'm looking up are not just so I can, talk about it on a stage or talk about it with my fellowship group. I can go to clinic the next day and that thing shows up. I'm like, oh, I know exactly what we need to do next. Like, I know exactly what the evidence is showing for this up until like yesterday, because that's when we've looked at it too. And so it helps us also be better clinicians, and then it helps all of the clinicians be better. Does that make sense?